This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, from Philadelphia to Erie and from Scranton to Pittsburgh, it's Behind the Headlines. I'm Charlie Greenewald, Senior Fellow of the Susquehanna Valley Center for Public Policy, and I'm joined as usual by my co-host, Maura Donnelly. Hi, Maura.
Hello, Charlie.
Why, we find that in this brand new year of 2019 that healthcare continues to be one of the major challenges for the Commonwealth of Pennsylvania, doesn't it?
Always, yes.
Yeah. And today, to discuss healthcare and hospitals, we are very fortunate to have with us Mr. Jeff Bechtel, who is the Senior Vice President for Health Economics and Policy for the Hospital and Healthsystem Association of Pennsylvania. Jeff, welcome back to the show.
Thank you. I'm happy to be here.
Well, it's really nice to have you. This is a new year with new challenges, yes. And HAP is one of the leading forces for improving health care on the Hill, Capitol Hill in Harrisburg here. You have so many issues that are of importance to the Commonwealth and to the medical community. Let's start out with this whole series of articles that we've seen on the news. They are talking about a proposed rule change to change the way that medical liability cases are tried. Can you share with our viewers a little more about this and how's your association, HAP, and Pennsylvania hospitals responding to this?
Yeah, I sure can. To talk about this, you first need some background. And I think
we have to go back to 2002.
That's right.
Or
it's,
before that,
15, 16 years, that's right. I think as you recall, and many of your viewers may recall, in 2002 and prior, several years prior, Pennsylvania was experiencing a medical liability crisis. Medical liability costs were skyrocketing. It was forcing physicians to either leave practice, or it was a deterrent for new physicians to practice in the Commonwealth.
Reduce their services?
Correct. For example, a number of OB units closed in the Philadelphia area. And it was affecting access to care, which is, of course, critically important. And why was this occurring? One of the reasons is that Philadelphia County at the time was an extreme outlier in terms of the number of cases that were brought in Philadelphia County relating to medical liability actions, the percentage of cases that were pro-plaintiff. It was actually twice the national average, and also the amount of the awards. So it was, again, an extreme outlier. And why that impacted medical liability rates across the Commonwealth is because under something called venue rules, which is rules governing where plaintiffs' attorneys could bring cases, the rules were very liberal. So, for example, if someone suffered a medical error and brought, in Cumberland County, for example, under the venue rules at the time, if there was any tangential relationship between the hospital, like for example, if the hospital was affiliated with a hospital in Philadelphia County, or if there was a medical device that was used and the medical device, for example, was advertised or sold in Philadelphia County, if there was any sort of tangential relationship, cases could be brought in Philadelphia County. And again, I think 44% of all medical liability actions between 2000 and 2002 were brought in Philadelphia County because of that tangential relationship. What happened, I think anticipating your question, is at the time the General Assembly and the administration at the time acted. They proposed legislation, the MCARE Act, which was designed to deal with frivolous lawsuits, was passed. And as part of that legislation, the legislation created something called an inter-branch committee on venue. And this committee was tasked with the responsibility of evaluating the venue rules that I was just talking about. And as part of their recommendations, they recommended that the venue rules be changed. And the specific recommendation was that they be changed to only permit lawsuits to be filed in the county where the cause of action occurred. That recommendation was adopted by the General Assembly and also by the Supreme Court in 2003 which changed the rules.
So almost instantly, we had doctors staying, doctors returning. We were at a crisis level in 2002 before this passed. Doctors could not afford the medical liability insurance. They were leaving in droves. The General Assembly fixed it. Now there's a rule that wants to eliminate it and allow people to shop around for a venue again.
That's exactly right.
And we could lose doctors again.
That's the
right?
concern. That's the concern.
Yeah.
It's sort of a head scratcher for physicians.
Why? Do we know why this has suddenly reared its ugly head again?
We don't necessarily.
Okay.
Obviously, this is something that trial lawyers would favor. But I think a couple points. When this change in the venue rules was proposed, and as you pointed out, it was recently proposed on December 22nd, the proposed rule change by the Civil Procedural Rules Committee of the Supreme Court was published in the Pennsylvania Bulletin. And we're confused because there is no public outcry. There is no evidence that individuals who may experience a medical error do not have access to the courts, or that the courts in individual counties are not rendering fair results. So that is why we're concerned about this. And one of the things that we've been pointing out, and others have been pointing out, that there's been a lot of changes to the healthcare delivery system since 2002, 2003, that really may amplify the negative results if we go back to the rules that were in place.
That's a good point, yeah.
One of them, there's been a lot of consolidations, as you know and your viewers know, which would even provide additional opportunities to venue shop in urban counties, for example, Philadelphia or Pittsburgh. We're still facing a workforce shortage for physicians. There's a deficit, projected deficit in the number of primary care practitioners in Pennsylvania by the year 2035. We do a great job educating physicians, but not a very good job retaining them. I think we're 4th in the country in educating, 37th in the country in retaining young physicians. So now's not the time. And of course, healthcare costs were certainly an issue in 2002 and 2003, but perhaps it's even more of an acute issue now in 2019.
Jeff, could you repeat those statistics to reinforce those with our viewers?
Yeah, I think, yes.
Fourth?
Well, we're 4th, and this was something that was included in the Joint State Government Commission report a couple of years ago, that we're 4th in the country in educating medical students.
We've got great medical schools.
Correct,
Yeah.
but 37th in the country in retaining those medical students to practice in Pennsylvania. So that's just something to point out.
So we're exporting them once we've trained them.
That's right. And we're also, even though the crisis has stabilized to a large extent, we still are one of the most expensive states when it comes to medical liability insurance. So for all of those reasons, and this is something to point out, that comments are due to the Civil Procedural Rules Committee. They are soliciting comments from the general public, and we're responding, of course, by February 22nd and encouraging others. But we're recommending that they rescind this proposed rule change, or at an absolute minimum, reconvene the interbranch.
The group that came up with the rule change in the first place.
That's correct.
Yeah.
The stakes are too high.
Right.
The healthcare system, it's a very complex ecosystem, is probably a way to describe it. The stakes are too high to make a change like this that could have such a dramatic impact, bring us back to the 2002 experience, and it needs to be carefully evaluated, in our opinion, before any changes are made.
So one of the biggest arguments is this is somehow going to restore fairness for in medical liability cases. What do you say about that?
I'll repeat. It's
no fairness.
There's been no outcry. We
Right.
do not see that individuals do not have access to the courts, that they're not rendering fair results, and that this solved a major problem that affected access to care for patients.
So this new rule is really not solving any kind of problem that's out there.
That's correct.
Interesting.
It's a solution in search of a problem.
Right.
We lost doctors after before that rule was put into place, Jeff. And if this rule goes into place, and we go back to the situation pre-2002, do you have any, or does HAP have any estimates on how many doctors we might lose?
We haven't gotten that granular, to be honest with you. And that's one of the reasons why we need to convene. If this isn't withdrawn, at a minimum, to evaluate the potential impact on access to care, on physician supply, cost, the impact potentially on the courts in Philadelphia and Allegheny counties. There's a whole host of issues that should be carefully evaluated. The impact on medical liability insurance rates. The list goes on. This is a complicated issue. A difficult problem was resolved. If any changes are made, it needs to be carefully evaluated. And again, our position is that this proposal should be withdrawn.
So the governor recently issued his new budget.
Yes.
And so I know you're probably staying on top of a few items in the budget. What's of most concern, or is there anything you're happy about?
I think overall we were pleased. Obviously, tax revenues were exceeding expectations, so I think this
always a good thing.
It's a good thing. It made this year a little bit easier. There isn't a broad-based tax increase. Three things that we wanted to stress. First relates to workforce development, and this ties into part of the conversation we just had. Obviously, the governor's budget address really focused on workforce development. And we wholeheartedly support those efforts. In addition to some of the physician statistics, we're facing a nursing shortage in Pennsylvania. So that's of great concern.
Are you going to be involved, or are you going to insert yourselves into his new command force?
Certainly, we would like to have
Workforce Development Command Force, whatever it's called.
We would like to have a seat at the table, certainly. Okay. I will say that one of our efforts is focusing on the workforce. For example, internally within our organization, we established something called a healthcare talent task force, where we identified leaders, hospital leaders and health system leaders from across the Commonwealth. We met internally within our organization a couple weeks ago, and we intend to meet over the next months with the goal of developing a detailed report with recommendations on how we could prepare the workforce pipeline for the needs of the future. We know a lot of changes are occurring, IT, artificial intelligence. This is a critical topic, and we hope that these recommendations will kind of plug in with the governor's efforts, and we intend to provide our recommendations to the administration. I'll also point out that the Joint State Government Commission, at the direction of the General Assembly, is studying this issue, and we expect to see a report from that commission in late April, we believe. And that could be helpful to this debate, but we're very pleased with the focus on workforce development, because that's critical to our industry.
Great. Everyone seems to be happy about that one. What else?
A second thing is the focus on the opioid crisis.
Oh, yeah.
Hospitals are on the front lines and deal with this on a day-to-day basis. And the budget focuses on this topic. There's, I think, $1.5 million for naloxone for first responders, additional funding for the prescription drug monitoring program that tracks opioid use, some money for visiting families of individuals who with opioid use disorder. So there's a significant commitment of resources. There's also funding in the budget to provide hospitals with resources to perform something called warm handoffs, basically to ensure that individuals that present in emergency departments receive treatment in the community immediately following that admission. And that's something we're working in partnership with the administration to make sure that happens. So that was something we were very happy to see. Just a final point on the budget, hospital funding is always critical,
an issue.
always an issue, especially when there's tough budget times. State and federal governments sometimes look to Medicaid, Medicare, and other supplemental payments. This budget fully funds some of the supplemental payments to critical access hospitals that serve our rural communities, burn units, OB units. So we were very happy to see the ongoing commitment to hospitals, which ensures access to care for Pennsylvanians.
That's great.
Well, Jeff Moore and I want to thank you, and our viewers wish to thank you very much for sharing your time with us today and your expertise. Well, we hope you'll come back soon and bring us up to date on how these issues are developing in Pennsylvania in the next few months.
Appreciate the opportunity. Be happy to do it.
Thanks.
Okay. Stay tuned for the next segment of Behind the Headlines. We'll be right back.
Behind the Headlines is brought to you as a public service by the Pennsylvania State Association of Township Supervisors, the largest, most influential municipal association in the Commonwealth. Since 1921, PSATS has been preserving and strengthening township government and securing greater visibility and involvement for townships in the state and federal political arenas. Covering 95% of Pennsylvania's land mass, townships represent 5.5 million residents, more than any other type of political subdivision in Pennsylvania. Behind the Headlines is also brought to you by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Welcome back to the second segment of Behind the Headlines. On this segment, Maura and I are fortunate enough to be joined by Lowman Henry, the president and CEO of the Lincoln Institute. Lowman, welcome to the show.
Thank you. Good to be here.
Hi, Lowman.
Hello.
Why, for many, many years, you have been the steward of the Pennsylvania Leadership Conference. This event is coming up shortly this spring here in the capital of the Commonwealth. And it always brings in fantastic speakers, and it always brings in a lot of publicity for different causes and for the different speakers that are appearing there. I wondered if you could share with our viewers, Lowman, just a little bit about the Pennsylvania Leadership. What is the purpose of it? And if you could give a sketch of the history of it, if you wouldn't mind.
Well, actually, this is a very historic year for us. This is the 30th anniversary Pennsylvania Leadership Conference.
Congratulations.
Yes, hard to believe. It was 1989. Ronald Reagan had just left office. We had the fall of the Berlin Wall and all those sorts of things. And here we are 30 years later, and it's bigger and I think hopefully better than ever. The Leadership Conference, many of your viewers probably in the last couple weeks saw a lot of coverage of the CPAC conference down in Washington, D.C. And the Pennsylvania Leadership Conference was patterned after CPAC. Now, it's not affiliated with CPAC, but 30 years ago, 2 college students went to CPAC and they came back to Pennsylvania and they said, wouldn't it be great if we would have something like this in Pennsylvania? So they went at the time to Fred Anton, who was longtime chairman of the Pennsylvania Manufacturers Association, and Susan Staub at Right to Work, and said to them, what if we do a conference like that? Fred and Susan loved the idea, so the first Pennsylvania Leadership Conference was held in 1989. There were a couple of hundred people there, and the featured speaker at the very first one was a little-known congressman from Georgia, a guy by the name of Newt Gingrich, who of course went on to become Speaker of the House. Newt, of course, is from Pennsylvania, just outside of Harrisburg here in Hummelstown. So from that beginning, the Leadership Conference was launched. And it went quite well throughout the 1990s, sort of fizzled a little bit around 2000. But then Mr. Anton decided, hey, we really need this. You had Pat Toomey, who was beginning his process of running for the United States Senate. There was a new burst of energy in the conservative movement. So the conference restarted. And then a couple of years later, we had the Tea Party movement, which brought a whole lot more activists into it. And so here we are. We now have 800-900 people, especially in presidential years. And 30 years later, the conference is off and running, and we again this year on April 5th and 6th at the Radisson Penn Harris Convention Center in Camp Hill, right outside Harrisburg. We're going to have conservative activists from all across the state concerned about all sorts of issues here for the conference.
So your speaker this year, you have many speakers. Let's talk about the big one right now is Kimberly Strassel. Can you tell our viewers a little bit about her and why she was selected? It should be fascinating to hear her speak.
One of the things we try to do with our conference is, of course, people always like it when you get really big, flashy political names and all that in, but the conference is really a grassroots issues conference. Kimberly Strassel writes for the Wall Street Journal for their editorial page. She is one of the foremost conservative thinkers today. She frequently appears on Fox News and even on Meet the Press and other mainstream media. She recently, or about 2 years ago, I guess it was, wrote a book on the deep state and how the deep state tries to silence conservatives, which of course is a big issue. So she will be our featured dinner speaker on Friday, April 5th, and we are really looking forward to having her. We've had a who's who of speakers over the years at the Leadership Conference from the conservative movement, and we are very pleased to be welcoming her this year.
Well, I was excited to see that you have Selena Zita coming. She's
yes.
a Yinzer, a hometown girl. And for anybody who doesn't follow her on Twitter, you should, because she cooks a lot, and it's a lot of fun to. It's a lot of fun to follow her.
You always get hungry when you
Yes.
look at her Facebook page.
Exactly.
But Selena, of course, for many years wrote for the Pittsburgh and Greensburg Tribune Reviews. She now writes for the Washington Examiner and the New York Post, and she ventures into enemy territory and is seen on CNN quite a bit. She's going to be our luncheon speaker on Saturday.
Great.
So, and we're always excited not only to have national people like Kimberly Strassel, but also our homegrown talent as well.
Right. She's
great.
Fun.
Have you ever tried to, I know having someone like Newt is a fantastic feather in your cap. Are there plans in the future to, you mentioned the Tea Party, to maybe at some point see if you could bring Glenn Beck there, or Bill O'Reilly or Sean Hannity, any of the other Fox people, Lowman?
Well, we have over the years talked with their agents. Their fees, however, are very, very large.
Oh.
And so money has been sort of a barrier to having those particular names.
They're not willing to do this gratis.
They're not, oh no, they don't do it gratis. But we've had Ben Shapiro and numerous others who we have had in over the years. We've been very fortunate that we're usually able to get people on their way up, so you can have a reasonable fee and still get a pretty big name. Ann Coulter spoke many, many years ago, and we got her at a very reasonable rate. Charles Krauthammer, you'll love this. Charles Krauthammer came and spoke. I think it was one of the best speeches we ever had, and anybody who watched Charles would know that. I found out a year later another organization in Pennsylvania booked him, and they paid 5 times what we did. That's how much the rate went up.
Wow.
So you have to get these people at just the right time.
Maybe this year would be a good year to take bits and pieces of that original speech by him and feature that since he passed. What a great loss to the to America, not just the conservative community, but to America and to the press.
Well, we've never had the same featured speaker twice in our 30 years. Were we to have the same featured speaker again, Charles would have been right at the top. Now, regrettably, that's now not possible, but certainly he was impressive the night he came to speak. He got up on the stage and he sat there and he had this thick notebook, which he placed in front of him, and he spoke for almost an hour, and he never even looked down at the notebook.
Oh, some sort of security blanket then.
It must have been a security, but
Yeah.
and people sat there. It's hard for people to keep somebody's attention for that long.
Right.
Nobody left, nobody stirred, everybody paid rapt attention to him. That's a really good speaker. He and Michael Reagan stand out over the years as two who were able to do that.
So I think our viewers would be very interested to know that not only is there are a plethora of phenomenal speakers and topics to be discussed, but there's also a sponsor and exhibitor area. Can you talk a little bit about that at your event?
That there are. We usually have somewhere between 40 and 50 organizations from the national level. We have the national level think tanks like Heritage Foundation and many others who will come in and exhibit from the national level. Excuse me, but we have a lot of grassroots organizations from around Pennsylvania, and not only the state level organizations, like Americans for Prosperity and the Commonwealth Foundation, but a lot of the local Tea Party groups and local organizations will be exhibitors as well. And I've always thought that was the most significant part of the leadership conference. All the speakers are great. We have panels where we talk about state and national issues. We have workshops, but I've always thought the best thing about it was the networking. where you can bring people from all over the state together who are activists in all sorts of issues, and they meet each other and they find out that, no, I'm not the only one who is out here fighting this fight by myself.
Yes, you find your kindred spirits when you come to that event.
And the exhibit area is one area where we do that, and as well as the various social functions that we have.
Lowman, what do, looking at the state and the challenges for example, the conservative movement, what does the conservative movement do to deal with this entrenchment that we see on so many fronts throughout society, whether it be labor unions, whether it be our educational institutions, whether it be the press, that all of those seem to be become anchored with the left and the more liberal movement. What do conservatives do to deal with this movement?
We are going to take that head on this year, and I'm glad you asked that, because as we developed the program with our speakers and our panels and panelists, it became very apparent that, believe it or not, we actually have to focus on defending the capitalist system, on defending free markets, and on defending pro-growth economics. Because on the left, their rush toward socialism has become so pronounced that this year we want to talk about why our conservative way of doing things is better and, unlike socialism and the left, actually works. So we're going to, for example, we have Jimmy Kemp from the Jack Kemp Foundation. He's coming to talk about empowerment zones and how private investment in inner cities can help lift people out of poverty. We're going to talk about that. To your point, we have a panel where we're going to specifically talk about messaging. Now, why is it that the left is more successful in having its message resonate? Well, that's because they couch it in very nice, touchy-feely terms. The Affordable Care Act, the Defense of Women Act, all sorts of things that sound like mom and apple pie, but when you get down to it, what you really have is socialism creeping and now galloping. So we're going to talk about how conservatives should message and how we can get our point across, and then we're going to take on those entrenched interests like public sector labor unions. We have Mark Janus. Mark Janus was the plaintiff in the landmark Supreme Court case.
Yeah.
Recall last June, it was a Supreme Court case where the Supreme Court said it's a violation of your constitutional rights to be forced to pay any money to a labor union or to join it if you don't want to. Mark was the plaintiff, and he will be here.
Unfortunately,
yes, but one last thing.
We're out of time.
Website.
A website, paleadershipconference.org. April 5th and 6th, you can register at paleadershipconference.org.
Thank you very much, Lowman, for that. And you need to come back really soon and tell us how the conference worked out. And we'll be back again with you next week on Behind the Headlines.